House Bill 114. Imagine this. Your local veteran group runs a small counseling night at the library. They apply for state help to add more sessions. The new rules say they first have to raise public dollars to match any state grant. They try, but the big city nonprofit down the road has a fundraiser and gets the award instead. Now, what the bill says it does: move veteran mental health programs for Health and Human Services to the Texas Veterans Commission and create grants to expand services, training, and suicide prevention planning. Now, what it actually does: this means the Veterans Commission can now write the rules, score applications, and hand out the money, while smaller providers lose the ability to compete if they cannot raise private matching funds. It also shifts staff and contracts into the Veterans Commission and sets a short term suicide prevention planning timeline. Now, who this benefits: Veterans Commission leadership that controls the grant pipeline, large, well funded nonprofits and veteran service groups that can raise private matches, and providers with prior grant experience and dedicated fundraising staff. Now, who pays for it? Rural communities and small community groups that cannot meet match rules, public hospitals or local mental health centers that depend on state or federal dollars, and veterans in areas where no one can assemble the private match. Now, why this matters: who controls the money decides who gets care. If access depends on private fundraising, veterans in wealthy areas get more services while others wait. Once this pipeline is set, it becomes the model for future funding choices, and the public has fewer ways to see or challenge how decisions are made. Questions to ask your lawmakers: how will veterans in rural or low-income areas get services if local groups cannot meet the match? Will you require public scoring rubrics, published award reasons, and an independent performance review? Will you add waiver options or set asides so small providers can compete on need, not fundraising power? Now, the bottom line: House Bill 114 centers control at the Veterans Commission and ties help to private matching dollars, which can leave too many veterans on the outside looking in.